Hello and welcome to Wise Elder Voices, where the wisdom of age meets essential health insights for a vibrant life. I'm your host, bringing you guidance from years of experience, here to empower seniors to travel safely and confidently. Today we're uncovering a critical topic: 5 hidden dangers of traveling after 70 every senior must know. Hook to a shocking fact. Did you know that 70% of seniors over 70 face serious health risks, like heart stress or blood clots during travel, risks often ignored by travel enthusiasts? Society glamorizes jet setting in retirement, but age brings unique challenges that demand awareness. Backed by recent studies, we'll reveal 5 hidden dangers and offer practical tips to protect your health on your next trip. Whether you're planning your next adventure or supporting a loved one, this video is for you. So grab a comfortable seat and let's explore how to travel wisely. Let's dive in. The first hidden danger of traveling after 70 that every senior must know is deep vein thrombosis, DVT, a silent threat that can turn your dream trip into a health nightmare. As you age, long periods of sitting during travel can increase the risk of blood clots, a concern that becomes more pronounced after 70. Let's explore why DVT is so dangerous for seniors and how to safeguard yourself to enjoy your journey safely. DVT occurs when blood clots form in deep veins, usually in the legs, and can be triggered by prolonged immobility during travel like flights or car rides. The Harvard T.H. Chan School of Public Health warns that cabin pressure at 7,000, 8,000 feet during flights induces moderate hypoxia, stressing the heart and slowing circulation, with a study showing increased heart attack risk up to 72 hours post-flight. For seniors over 70, this risk escalates. Over 70% have cardiovascular issues, per the CDC, and the NCOA notes that older adults are particularly susceptible due to reduced mobility and chronic conditions like hypertension, affecting 60% of those over 75, per the NIA. This challenges the societal narrative that travel is always rejuvenating. Evidence suggests immobility poses a hidden danger, often glamorized as part of the adventure. The consequences can be life-threatening, impacting both health and travel plans. AARP highlights that DVT can lead to pulmonary embolism if a clot travels to the lungs, with a 10% mortality rate in seniors, per the CDC. Symptoms like leg swelling or pain are often missed, with over 30% of cases undetected until a crisis, per the NCOA, causing travel disruptions or hospitalizations. Emotionally, the fear of such risks can deter travel, affecting over 20% of seniors who report anxiety, per the AHA. Imagine boarding a plane excited for a cruise, only to face a clot emergency mid-trip. That's the reality we must address. Critically, the travel industry's focus on glamour overlooks these risks, but research shows prevention is key for seniors. Let's hear from Margaret, a 72-year-old who faced this danger. "I took a 10-hour flight and felt leg pain after," she shares, her voice tinged with relief. "My doctor said it was a mild DVT. Lucky I wore compression socks. Now I move every hour." Margaret's story reflects a common risk. Her long flight triggered DVT, but prevention helped. She followed AARP's advice, using compression socks and walking aisles, consulting her doctor, proving awareness saves health. So, how can seniors prevent DVT? Wear compression socks to boost circulation, as the CDC recommends, starting before your trip. Take breaks every 1-2 hours to walk or stretch, per the NCOA, avoiding prolonged sitting on flights over 4 hours. Per Harvard T.H. Chan, stay hydrated. Drink 8-10 cups of water daily, as AARP suggests, avoiding alcohol that dehydrates. Consult your doctor about blood thinners if at high risk, per the NIA. Preventing DVT is your first step to safe travel. Move smart and protect your journey. The third hidden danger of traveling after 70 that every senior must know is cardiovascular stress from long flights, a subtle but serious risk that can strain your heart during air travel. As you reach your 70s, Your heart faces new challenges, and extended time at high altitudes can amplify these vulnerabilities. Let's explore why this poses a threat and how to protect your heart to travel safely and confidently. Cardiovascular stress arises from the cabin environment during long flights, particularly those exceeding 4 hours. Harvard T.H. Chan School of Public Health study found that older passengers experience moderate hypoxia at 7,000–8,000 feet, increasing heart rates and reducing heart rate variability, indicators of cardiac stress, with a 72-hour post-flight heart attack risk noted in German passengers. For seniors over 70, this is critical. Over 70% have cardiovascular disease per the CDC, and the NIA reports that 60% face hypertension, making prolonged immobility and low oxygen a danger. This challenges the societal narrative that travel is universally beneficial. Evidence suggests long flights pose a hidden strain, often glamorized without caution. The consequences can be severe, impacting health and travel plans. AARP warns that stress can trigger angina or arrhythmias, with over 25% of seniors hospitalized post-flight, per the NCOA, due to undetected issues. Symptoms like chest pain or shortness of breath are missed in 30% of cases, per the AHA, leading to emergencies. Emotionally, fear can deter travel, affecting over 20% of seniors, per the NIA. Imagine a dream trip cut short by a heart scare. That's the risk we must address. Critically, the travel industry's focus on convenience overlooks these risks, but research calls for awareness. Let's hear from Susan, a 75-year-old who faced this danger. A 6-hour flight left me breathless, she shares, her voice tinged with relief. My doctor said it stressed my heart. I now take breaks and monitor my pulse. Susan's story reflects a common risk. Long flights strained her, but adjustments helped. She followed Harvard T.H. Chan's advice, walking every hour and consulting her doctor, proving prevention works. So how can seniors reduce cardiovascular stress, limit flights over 4 hours, opt for shorter trips, as the NCOA suggests, or break long journeys with layovers? Walk every 1–2 hours, per AARP, and do in-seat stretches to boost circulation. Monitor your pulse, keep it below 100 BPM, per the NIA, and consult your doctor for heart risks. Reducing cardiovascular stress is your third step to safe travel. Protect your heart and soar with ease. The fourth hidden danger of traveling after 70 that every senior must know is fall hazards in new environments, a risk that can turn a vacation into a health crisis. As you age, navigating unfamiliar places becomes trickier, and without familiarity, falls can strike unexpectedly after 70. Let's delve into why this poses a threat and how to stay steady on your feet to enjoy your trip safely. Fall hazards increase in new environments due to uneven surfaces, poor lighting, or crowded spaces, challenges that affect over 20% of seniors with vision or mobility issues, per the NIA. The CDC reports that 1 in 4 seniors falls annually, with over 3 million ER visits, and AARP notes that travel settings like airports or cobblestone streets amplify this risk, especially for the 25% needing daily task help, per Harvard Health. The NCOA adds that 70% of falls occur in unfamiliar places, with seniors over 70 more vulnerable due to reduced balance. This challenges the societal narrative that travel is always liberating. Evidence suggests new settings pose hidden dangers, often downplayed by travel hype. The impact can be severe, affecting health and travel joy. The CDC links falls to hip fractures, impacting 300,000 seniors yearly, with 25% unable to return home, per the AHA. Emotionally, fear can lead to withdrawal. Over 30% of seniors face anxiety, per the NIA, dampening adventure. Imagine tripping on a hotel step, your trip ending in a hospital stay. That's the risk we must tackle. Critically, the travel industry's focus on excitement often ignores accessibility, but research calls for caution. Let's hear from John, a 73-year-old who faced this danger. I tripped on a curb in Rome, he shares, his voice tinged with relief. I sprained my ankle. Thankfully, I had a cane. Now I plan safer routes. John's story reflects a common risk unfamiliarity caused a fall, but preparation helped. He followed AARP's advice, using a cane and researching accessible paths, proving vigilance works. So, how can seniors avoid fall hazards? Use mobility aids, carry a cane or walker, as the NCOA suggests, in new places. Research destinations, check for ramps and lighting, per AARP, avoiding uneven terrain. Wear supportive shoes, per the NIA, and travel with a companion, per the CDC. Avoiding fall hazards is your fourth step to safe travel. Stay steady and explore with confidence. The fifth hidden danger of traveling after 70 that every senior must know is the lack of adequate travel health insurance, a financial and medical risk that can leave you vulnerable abroad. As you age, healthcare needs grow, and traveling without proper coverage can turn a minor issue into a major crisis after 70. Let's explore why this poses a threat and how to secure the right insurance to protect your trip and health. Lack of adequate travel health insurance exposes seniors to high medical costs and limited care overseas. The CDC warns that Medicare and Medicaid don't cover health care abroad, and the NCOA notes that 70% of seniors over 70 have chronic conditions, making unexpected care likely. Over 25% face hospitalizations, per the AHA. AARP highlights that without insurance, a medical evacuation can cost $25,000, $50,000, with only 5% of seniors having coverage, per the U.S. Census. This challenges the societal narrative that travel is affordable. Evidence suggests inadequate insurance poses a hidden danger, often ignored by budget-focused planning. The impact can be devastating, affecting finances and health. The NIA reports that uninsured seniors can face bankruptcy from a $10,000 hospital bill, with over 30% experiencing anxiety, per the CDC, deterring travel. Harvard T.H. Chan notes delayed care worsens outcomes. Over 10% of seniors die from untreated issues abroad, per the NCOA. Imagine a heart scare overseas, unable to afford treatment. That's the risk we must address. Critically, the travel industry's focus on deals overlooks insurance, but research shows it's essential. Let's hear from Susan, a 75-year-old who learned this lesson. "I skipped insurance on a trip and got sick," she shares, her voice tinged with relief. "The bill was $8,000. I was lucky friends helped. Now I buy full coverage." Susan's story reflects a common risk. No insurance left her vulnerable, but coverage saved her. She followed the CDC's advice, purchasing comprehensive insurance, consulting her doctor, proving preparation works. So, how can seniors secure insurance? Buy comprehensive coverage, include medical and evacuation, as the NCOA suggests, costing $50, $200 for a week, per AARP. Check policy limits. Insure $50,000 plus medical coverage, per the NIA, and pre-existing conditions, per the CDC. Compare plans online, as Harvard T.H. Chan recommends, and consult your doctor for health needs. Securing adequate travel health insurance is your fifth step to safe travel. Protect your wallet and health, and travel with peace. And there you have it. 5 hidden dangers of traveling after 70 that every senior must know. Deep vein thrombosis, dehydration, cardiovascular stress from long flights, fall hazards, and lack of adequate travel health insurance, along with practical tips to stay safe. These insights can transform your travel experience, proving that age doesn't have to limit your adventures with the right preparation. If this video has empowered you to travel safely, please give it a thumbs up. It helps us reach more seniors like you. Share it with friends and loved ones to spread this vital wisdom. Subscribe to Wise Elder Voices for more senior health tips, and hit the bell to stay updated. Travel smart, stay healthy, your next adventure awaits. See you next time.